Hi, I'm Dr. S. Leena Sankari. I'm a professor in the Department of Oral Pathology and Oral Microbiology. The topic today that I'll be dealing with is salivary glands. In the salivary glands, today we'll be seeing the introduction of salivary glands, the organization of salivary gland, and the serous cell. Glands are of two types, exocrine gland and the endocrine gland. Exocrine gland directly secretes the hormones into the bloodstream, and the exocrine gland secrete the substances with the help of ducts. We know there are three pairs of major salivary glands, and now a recent introduction has been the tubarial glands. So now the four major salivary glands will be the parotid gland, submandibular gland, sublingual gland, and the tubarial gland. And we also have minor salivary glands all over the oral cavity except for the anterior part of the hard palate, the gingiva, and the dorsum of the tongue. Coming to the organization of the salivary gland is divided into parenchyma and stroma. The parenchyma will include the ducts and the terminal end pieces, also referred to as the acini. The stroma is the connective tissue. It forms a capsule around the salivary gland, and this also divides the parenchyma into bigger lobes and smaller lobules. Coming to the structure of the salivary gland is divided into acini and ducts. Acini is otherwise known as terminal end pieces or the secretory end pieces. The ducts are of three types: the intercalated duct, the striated duct, and the excretory duct. The cells in the terminal end pieces will include the mucous cell, the serous cell, and the myoepithelial cell, and all these cells are centered around the lumen. And the shape of the terminal end pieces can be either spherical or tubular. Usually the serous acini is spherical in shape and the mucous acini is tubular in shape. And therefore the salivary glands are said to be compound exocrine glands. Exocrine glands because they secrete through the ducts, and compound because it has multiple ducts which lead to the main terminal excretory duct. Ducts, as already mentioned, are of three types: the intercalated duct, the striated duct, and the terminal excretory duct. The intercalated duct and the striated duct together form the intralobular ducts, and the striated duct forms the terminal excretory duct. The cells are held together to one another by means of junctional complexes, and these junctional complexes include tight junctions or the zonular occludens, the intermediate junction or the zonular adherens, the desmosome or the maculae adherens. The junctional complexes holds the cell together, and these are said to regulate the permeability. Now let's see the serous cells in detail. Serous cells are involved in the synthesis, storage, and secretion of protein, and they have a structure typical of a protein secreting cell. The base is broad, close to the basement membrane, and the apex is narrow, pointing towards the lumen. It contains all the cellular organelles such as the rough endoplasmic reticulum, the mitochondria, and the secretory granules at the apex. The secretory granules initially are immature, and they are represented by translucent granules. Once they become mature, they become electron dense. This is a light microscopic structure of a serous cell, and you have a central duct in place. The nucleus first receives its information from the messenger RNA, and it delivers the information to the ribosomes which are there in the rough endoplasmic reticulum. The ribosomes then synthesize amino acids, and this process is referred to as translation. Initially they are pre-proteins. They contain an additional NH2 terminal extension consisting of 16 to 30 amino acids, which are referred to as the signal sequence. With the help of the signal sequence, they attach to the rough endoplasmic reticulum. Later, a hydrolytic enzyme cleaves, which is referred to as the signal peptidase. It cleaves the signal sequence, and now it enters the cisternal space of the rough endoplasmic reticulum. The vesicles then from the rough endoplasmic reticulum enter the Golgi apparatus. You are well aware that Golgi apparatus has a cis phase and a trans phase. cis face also referred to as the convex face, and the trans face referred to as the concave face. In Golgi apparatus, a very important process takes place which is referred to as the glycosylation, which is nothing but addition of carbohydrate moieties. So, to the amino acids asparagine, serine, threonine, the carbohydrate moieties such as galactose, mannose, fructose and sialic acid are added. So, glycosylation is a multi-step process which begins in the rough endoplasmic reticulum and ends in the Golgi apparatus. The proteins are initially immature granules and later, by the addition of the content, they become mature granules. These secretory granules in a serous acini are also referred to as zymogen granules. So, this is an electron microscopic view where you can see the secretory granules situated in the apex of the serous cell. The contents are discharged via a process called as exocytosis. In exocytosis, there is a fusion of the granule membrane with the plasma membrane of the cell, leading to the release of the contents. When there is an influence of the drug, a compound exocytosis happens. This type of secretion is also called a merocrine type of secretion, which is seen in salivary glands, where the granule membrane fuses with the plasma membrane of the cell to release its contents without any loss of cytoplasm. We also have two other type of secretions which are also called apocrine and holocrine type of secretions. Apocrine, where the apical portion is pinched off to release the secretion, and this pattern you can see in mammary glands and sweat glands. Holocrine type of secretion is seen in sebaceous glands, where the entire cell disintegrates to release its contents, and this type of secretion is more common in sebaceous glands. Apart from the various organelles we mentioned earlier, we can also see free ribosomes which can synthesize secretory cellular proteins. We also have mitochondria, which happens to be the powerhouse of the cell. In addition to that, you can also see lysosomes, which are hydrolytic enzymes which are destined to destroy worn out organelles. With this, we conclude the organization, the structure and the serous cell. In the next part, we will go into details about the mucous cell and the differences between serous cell and mucous cell. Thank you.